us here in the studio is Allison Birdie. Allison is a speech-language pathologist at Hannibal Regional Hospital Pediatric Therapy Services. Whew, I was a lot younger before I even started your title. I'm just kidding you, by the way. Welcome, Allison.
Hello.
Good to see you. So tell us, what is it that you do?
I am a speech-language pathologist, and I do speech and language therapy with pediatric clients. And I work with a group of other speech therapists and physical and occupational therapists.
Okay, but there have been some changes made just recently.
Yes.
You're kind of like your own individual unit.
We sure are. They just separated us. We're still part of Hannibal Regional Hospital, but we have our very own pediatric therapy center. So we have a building that just houses physical, occupational, and speech and language therapy for children. And we are housed in the same building as the Hannibal Regional Hospital daycare and preschool program.
All right. Is this in response to a growing need for these kinds of services?
Hopefully. We're kind of expanding. We've had some additional therapists join us, and we needed more room.
Sure.
We were kind of all crammed in the same place, and sometimes it's better to have a little bit more room to treat kids so we can have proper equipment, and we have better treatment rooms and more individualized therapy rooms. So it's nice. It's more kid-friendly, also not being directly in the hospital next to patient care.
That has a lot to do with it, I'm sure.
Allison, you deal with children with speech issues. How is somebody diagnosed with that, and is it something that parents often recognize?
Yes and no. For speech and for any kind of delay, sometimes parents or daycare providers or grandparents, friends of the family, sometimes people will notice that they're not meeting their developmental milestones kind of like the other kids have. And there's a certain amount of variance that's normal, but it's not always good to wait and see. Sometimes people take a wait and see kind of perspective and want to wait and see if it comes along. And some of that is okay, but waiting too long can put your child behind. And there's so many skills kids need now before they get to kindergarten that we hate to see them get too far behind, because there's a lot of difference we can make before that age.
Well, that's what I'm wondering too, with this wait and see attitude. If it's something that you do have some recognition of, you should have it treated early on.
Absolutely.
As kids get older, is it tougher to deal with at that point?
It's tougher to deal with. It's harder to make up for lost time. Especially with speech and language, there's so much that develops based on your ability to communicate and understand. So much of learning is based on oral language.
Right.
And so if you don't understand what's being said, or if you can't communicate your knowledge back, then you can't demonstrate your ability to learn. So, when kids are starting to talk and they're starting to follow directions, if they're not doing that on time, they're getting farther and farther behind. And here we are throwing, sentences and paragraphs and reading books and things, and if they're not getting it in, then they're going to get farther and farther.
What things do you watch for, not only with the speech, maybe they don't talk properly, but what other things? Because it's speech and language. It's our ability to communicate overall, too.
Language typically is what we think of with how people communicate. Language develops first. Speech is more how your speech sounds, a certain way you articulate, and if you're pronouncing things properly, if you're making your sounds correctly, if you can be understood. Language is the words that you're using, if you're putting sentences together, if you are using the right kinds of communication, the right kinds of words to mean the right things, using language socially. Those are some of the basis of language, and also being able to understand what other people say and ask you to do.
All very important things for Rich and I.
Well, this gets to my next question, because when I was in elementary school, back when I was in second grade, one of my teachers recognized that I had a pronunciation/enunciation problem by using S's. I wasn't saying my S's properly. And I went through about 5 months of therapy with an in-house therapist within the school district and solve the problem. Do you get a lot of references from teachers that say this person may have a problem, or do they go to the parent and then the parent gets to you?
Within the school system, that's more common. A lot of school districts do screenings, and then a lot of teachers make referrals and things like that.
Okay.
We often start with the younger kids. We treat birth to 18 basically at our facility. So some of the late developing kids. So we have a lot of 1, 2, 3, 4, 5-year-olds that come to our facility that are just now developing the speech skills. We also help with those are higher level things, and a lot of times those will be addressed in the school. Those are things that we can also help with.
Okay.
And that's pretty common. Sometimes teachers will notice that. Sometimes parents will notice that.
Interesting. So there's different kinds of therapy. It all depends on what's going on with this individual. And you apply accordingly. All right. So get it. Notice it early and take care of it early, like you and Greg were talking about. So how do parents get more, if they think their child may have, there may be a red flag that pops up, can they just give you a call and then you kind of talk them over about the situation?
If they do think there's something going on, and I can give you just some kind of ideas for the younger kids, which are some ideas of what might show a need for an evaluation. But if there is a concern, they can call us. We will offer a free screening. If they're not sure if it's worth an evaluation or worth talking about it to their doctor, they can call us at the Pediatric Therapy Center. We'll do a short screening for PT, OT, or speech to look at their concerns and let them know if we think it's worth evaluating. And that would be no charge. They can also talk to their pediatrician, their family doctor, their nurse practitioner about it and get what's a script requesting an evaluation for physical therapy or occupational therapy or speech therapy, and then they can call. Their doctor will sometimes call and set it up, or we can call and set it up once we receive the order and set up for an evaluation and then go from there.
Okay, good to know. And what kind of hours do you have it there at the clinic?
We are open Monday through Friday. Our hours are pretty flexible. We tend to schedule patients according to kind of when they can be seen within reason. Yeah. So sometimes we're there as early as 7:30 in the morning, and sometimes we're there as late as 6 at night. Okay. We try to be flexible. Obviously, we have to fit a lot of people in, so we try to work around people's schedules.
Okay. And how does payment work? Because you're probably dealing with a situation in the medical environment where people have some assistance, hopefully.
Yeah.
But if not, you've got other things available.
We have lots of options. We take insurance. Insurance companies will cover different kinds of therapy, and that's always different for physical and occupational and speech, and that is something that people can check with their insurance company and see what's covered. We do take Missouri Medicaid. There's several forms of that. We have some people who self-pay, and there's some payment programs offered for that. And we've also, this just applies for speech therapy, not for PT and OT, but we have been given a grant from the Scottish Rite Foundation. And so we have a scholarship program going for speech therapy for kids who show a need and they can't get therapy through other payment sources. They can apply for a grant and receive low-cost therapy services.
Okay, good. So there's a number of options available there. Interesting. All right. So do you have a telephone number where we can call?
Yeah. We are located in Hannibal on the Hannibal Regional Hospital campus. They can reach us at two different phone numbers. They can either call 573-248-5346 or 573-406-5777. And our fax number is 573-231-1034.
Just the fax, ma'am. Just the fax. I'm having fun with you. You're taking this way too serious, Miss Allison. All right. It's good to know that there's something like this available because you are meeting a need. That's for sure. Especially for
we
people
like our kids a lot.
Especially people like
helping,
me.
And we've had some really great results. So
good to know.
Some really great success stories.
We have. And
Very good.
It's good to know.
Okay. That's Allison Birdie, speech-language pathologist at Hannibal Regional Hospital Pediatric Therapy Services. Allison, thanks for dropping by.